Record, yeah.
Like,
perfect. Okay.
and here
So
we are in surgery with Dr. Knievel Cutterday. Dr. Knievel, do you
Yes.
mind if I ask you a few questions before you get started with this heart surgery?
That's okay. The patient is asleep still for a few hours.
And who is it that we have here on the operating table? And what is the surgery that you're performing today?
It's the most interesting heart surgery. It's an open heart surgery, and we did the first stage. I opened up the ribs already, and now we're gonna really go in. So you come at the right moment, and the patient's name I can't reveal. That is strictly private information. So I'd ask you to really be quiet, and if you happen to feel faint while observing this surgery, then you should tell the assistant and make sure you walk out before you fall over the patient.
Okay, and this is an open heart surgery?
This is an open heart surgery, as I explained to you earlier, and the CAT scan has revealed that she might have an extraordinary condition, which is BICOR syndrome. That means two hearts. She might have two hearts. And now I want to verify that. We should move on, because she cannot afford to stay another extra hour under anesthesia.
Thank you, doctor.
If you stand right there so you have a good view. I'm so sorry I have too many things happening, but could you step carefully over it without making an unsterile field? I hope you can do that in your lovely dress. Sorry we didn't have a gown your size. So I will check the fluid is fine. I will reveal the surgical field and we'll start cutting. This is perfect. So we'll make a sterile field. This is the iodine. You always have to be plenty generous on the iodine. I put a little bit on my gloves too. For the extra bleeding, I put tampons, different places, and a few extra. Alright, so we go in. I use this tool to open up the ribs, and now I will make the first slice in the flesh. I'll put some more of my surgical instruments, and if it is the case, this is another suction device that goes in my reservoir bag. I'm ready to do this. The first layer is being cut, and I'll open it up. So the sternum has been opened and lays on either side, and I will reveal the first layer of flesh. There it is. And now you can already see the first glimpse of the heart, and it indeed looks like a BICOR syndrome. There's a lot of blood here, so I have to... Oh, please don't touch the patient. Alright, this is the second cutting. We come close. And now I will open this up. And now you will see indeed this most rare condition, BICOR syndrome. Since this heart lays in the perfect position and it has the aorta and all the main blood vessels attached, this is being fed by a separate artery. And it looks like in many conditions, as research from Canada has proven, that in the few cases of BICOR syndrome that have been reported, this particular patient must have lost not a heart, but somebody lost their heart to her. Isn't that amazing? They have done research. Somebody has actually a broken heart and may have died And the heart it's like a phantom heart has appeared in the chest of this patient. So we're gonna extract this heart. And at the moment I have extracted it, you should hand me the bowl, I will say so, and we'll put the heart carefully in the stainless steel bowl. And then we'll carry on very carefully, opening up the heart. Here it is, a beautiful heart. I'm gonna make one cut in the heart so you can see. I first will clamp off, I put a few clamps on the artery so she's not bleeding. Little suction. Yes, so this is clamped off, and here we go. We'll cut in the right chamber to the atrium, and we'll do it through the 3 layers, and look at that. How beautiful and rich in blood. So we'll cut out one more access artery here and clamp it. There it goes. And now I'm ready to lift it up. The underlaying layers first. There it goes. Clean it up, clean it up. And this is the incredible thing. Now the lungs will have more room for oxygenation. So I clean all the bottom layers. And now we're ready for the bowl. If you hold the bowl close, not too close, there it is. Look at that heart. Look, here was the artery that went in. It is an incredible heart. It's not good to be donated. Nobody can use this heart. I've cut in it, of course, and it doesn't have all the precious blood supply possibilities. So we'll put it in there. Thank you, you can put it there. And now we gotta go ahead and close the patient up. So we're gonna put the stitches. That's it. And we close up the different layers. One layer, other layer. There it goes. Wonderful. There was not too much bleeding. Could you empty this in the bowl? Wonderful. Okay, now we're ready to go. Now I have to count my cotton balls. 1, 2, 3, 4, 5, 6, 7. Make sure that everything is out. Can you put that also over there? More suction. I think we're fine. The final stitches will be done by my assistant. And so we leave kind of the surgical field intact. This is wonderful that you could attend this most uncommon condition of this patient. I thank you so much for coming, and I'll meet you when after I have washed up and will do, as you proposed, an interview. But this is a typical case about somebody losing a heart to this patient, which is really like a tragic situation. Tragic, tragic. So we have to also inquire if this patient is a good candidate for the Canadian research. So thank you so much. All the vital signs have stayed pretty consistent, as I could see on the screens. So it's perfect. Thank you so much.